Altered Physiology Mechanisms of Disease 1. This is week 5, episode 5, our final episode for our lecture series on stress and disease. In this particular episode, we will continue our discussion of the stress response and how individuals may cope with stressors, as well as resulting illness. The stress response, once again, is initiated when a stressor is present in the body, or it can also be perceived by the mind. Psychological stress may cause or even worsen several diseases or disorders. Things like anxiety, depression, insomnia are classic examples. As a more specific example, if we think about stress and allostatic overload, alterations in sleep can have damaging effects on elevating cortisol, insulin, and glucose levels. So with that being said, let's now talk about coping. Once again, as I mentioned, stress is a system of many processes. It includes or could include both physiological and psychological components. It can be also moderated by the intensity, duration, and nature of the stressor, as well as one's own perception and appraisal of the stressor and how they may cope with it. As I've mentioned, psychological stressors can be present. They may manifest in physiological, emotional, cognitive, and behavioral changes. They can also be linked to immune disorders, such as changes in your B and T cells, which are associated with adaptive immunity, and over time, they can be chronic. Identifying and reducing stress may help in disease prevention and illness management. It's also important to note that coping may be adaptive or maladaptive. There are several coping techniques that can be used to manage stress and try to mitigate the effects of stress on more maladaptive behaviors. Classic examples of maladaptive coping mechanisms may include excessive alcohol ingestion and smoking, and by extension, impact the effects of existing chronic illness. While maladaptive coping may contribute to adverse health effects, there are several strategies that can be beneficial and be thought of as more adaptive. They tend to be more problem-focused and include social support. Here are some examples of how individuals may perceive stressful life events and whether they may have effective or ineffective coping. In diagram A, you can see the example of effective coping actually enables the individual to return to a steady state following a transient stressful life event. However, ineffective coping in healthy individuals may lead to further distress and/or illness. When we think about the potential effects of stressful life events in symptomatic individuals, this is shown in figure B. Stressful life events can also have effective or ineffective coping. Effective coping may have little or no effect on the symptoms, but ineffective coping on an individual who is already symptomatic, for example, somebody who may have a more mild or early cardiovascular disease, may exacerbate their condition. Maybe they have a heart attack. Maybe they develop more severe hypertension, as some examples. Therefore, it is important to recognize signs and symptoms of individuals who may be experiencing particularly stressful life events. This may contribute to diagnosis and treatment, and it may have a moderating effect on the symptoms, as shown in Figure C, whereby proper treatment may actually inhibit symptoms, or perhaps the lack of treatment may actually exacerbate or create further symptoms. Here is a sample question to help you think about adaptive versus maladaptive coping mechanisms. What behavior is an example of an adaptive coping response to stress? Hopefully in this reflection question, you chose answer C, seeking social support. Once again, that is an example of an adaptive coping mechanism which may be beneficial during stressful experiences. Maladaptive coping can result in changes in behavior that contribute to potentially adverse health events. The examples in this question included increased smoking, changes in eating habits, and sleeping